Welcome to Virtual Visits at the New York Academy of Medicine Library. I'm Arlene Shaner, the Historical Collections Librarian at the Academy. Normally, I would be welcoming you to the library in person, but since we can't be together that way, I'll be sharing some highlights from our rare book collections with you in this virtual tour. The New York Academy of Medicine began building its library right after it was founded in January of 1847, and we have been open to anyone who wants to use the collection since 1878. The library has over 550,000 volumes, as well as all kinds of other materials, including archives, manuscripts, pamphlets, ephemera, and images. Everything in the collections is here because it tells us something about the history of health and medicine. We also have lots of digital content you can explore from anywhere. Visit us online to learn more about the library and explore our resources. Welcome to this month's virtual visit to the New York Academy of Medicine Library. Get the word out, sharing public health information. As we go about our daily activities these days, there are signs everywhere reminding us that while we're in the middle of the COVID-19 pandemic, we need to protect ourselves and others by following some pretty straightforward health advice. Wear a mask, wash your hands, stay 6 feet apart from others, and stay home if you're sick. Public health campaigns like this one are not new, and in this month's virtual library tour, we'll be looking at some earlier campaigns aimed at sharing health information with various audiences. This broadside dates back to 1862 or 1863, when George Updike served as the mayor of New York City during the Civil War, and is a public call for vaccination compliance. Regular smallpox outbreaks sickened many people, but vaccinations had been available for more than half a century when this announcement was printed. The broadside gives the location of 5 dispensaries where people could go to be vaccinated without charge. The Metropolitan Life Insurance Company published hundreds of pamphlets offering health advice. This one from 1913 about smallpox and its prevention begins with a short account of the long history of the disease, and then goes on to explain how the use of inoculation and then Edward Jenner's vaccination technique helped control smallpox outbreaks and minimize their effects. It goes on, though, to warn that a single vaccination did not provide permanent immunity, and revaccination was necessary. The pamphlet also reminds us of the importance of collecting good data and ends by reproducing a poster made for the Chicago Health Department that offers a graphic illustration of how awful a smallpox infection could be. A later Metlife pamphlet, this one from 1938, reminds people that despite the availability of the vaccine, smallpox outbreaks continued in many states for reasons that are familiar to us today, including a failure to vaccinate enough people or to enforce vaccination laws, misunderstandings about the seriousness of the disease, and inadequate public health campaigns. Ultimately, though, smallpox became the one contagious disease to be completely eradicated worldwide through the efforts of the World Health Organization, and the vaccine is no longer given. Yet another Metlife pamphlet, this one from 1916, uses a series of 2-color illustrations to dispense some basic health advice, advocating for sunshine, fresh air, and soap and water to preserve good health. One of the diseases the advice is directed at is tuberculosis, depicted here as a ferocious dragon. Despite many health advances, tuberculosis, both latent and active, persists as a serious illness around the world, including in the United States. Other images encourage people to purchase milk and food from vendors who follow sanitary guidelines and sell clean and pure products, and a very graphic illustration reminds us that insects such as flies and mosquitoes are unwelcome spreaders of disease. Campaigns against tuberculosis took many forms. This little pamphlet from the New York Tuberculosis Association displays a map of all the clinics in Manhattan and the Bronx on the back, including Mount Sinai Hospital's dispensary, located just south of the New York Academy of Medicine. And it provides basic caretaking instructions for those living with someone who has the disease, counseling fresh air, good food, and rest, but also advising that the patient sleep in a separate and well-ventilated room. Sets of posters produced by the National Tuberculosis Association appeared year after year and were great attention grabbers. The advice is very much like what we saw at the very beginning of this tour. Wash your hands because germs hate soap and can be transferred to food and surfaces by dirty fingers. This cheerful weightlifting fiddle reminds us that regular physical exams help everyone stay healthy. The last tuberculosis prevention poster we'll look at uses isotypes, the International System of Typographic Picture Education pictograms, first developed in Vienna in the late 1920s as a way of conveying complex concepts by deploying very simple graphics in combination with plain language. This poster depicts the many ways in which tuberculosis could be passed from one person to the next. We'll leave disease behind for a moment to take a look at the Metropolitan Mother Goose from the 1920s. It begins with a rhyme about the kindly local doctor who dispenses health advice as little children climb onto his chair and into his lap. Much of what he says is as valid now as it was a century ago. Not only do these children happily make their beds and draw their own baths in the morning, but they even wash out the tub on their own, sometimes with a little help from a kitten friend. This especially charming double-page spread encourages plenty of outside play in the fresh air. We'll turn our attention back to items focused on disease. Like Metlife, the John Hancock Mutual Life Insurance Company printed many health pamphlets, and this one, a true adventure story, captured the world's attention in 1925. If you've ever taken a walk on the East Drive of Central Park, just north of the zoo, you've probably encountered the statue of Balto the Sled dog, which appeared in the park on December 15th of that year. Months before, in the middle of winter, a deadly diphtheria outbreak began in Nome, Alaska. With only a tiny supply of antitoxin on hand, people feared the worst, but a doctor in Anchorage had much more, and 3 dog sleds sped almost 700 miles through blizzard conditions to deliver the life-saving doses, completing the whole trip in just 5.5 days. Balto, the lead dog for the first sled that arrived in Nome, became a celebrity. The text reminds us, though, that while diphtheria was one of the most fatal childhood diseases, by 1925 it was also both treatable and preventable. These leaflets from the same time period were produced by New York's Diphtheria Prevention Commission and handed out to school children to take home. They were printed in many languages to make the information in them as accessible as possible to families where English was not the first language. Here's the Spanish version of the leaflet, which explains to parents that it takes just 3 visits to the doctor for injections of antitoxin to protect their children, and assures them that vaccination is both safe and easy. The discovery of diphtheria antitoxin in the 1890s, used first to treat those who were sick, and then of the toxin-antitoxin combination that conferred immunity, brought the disease under control by the 1930s. And of course, the vaccine is part of the regular series of immunizations babies receive today. Some health information posters targeted very specific communities. One of the dangers soldiers serving in the South Pacific during World War II faced was malaria, and graphically arresting illustrations like these, printed by the Government Printing Office in 1943, reminded servicemen to protect themselves by doing things like covering exposed skin, using mosquito repellent, and sleeping under bed nets. Some of the posters were illustrated by people whose work either already was or would become familiar to almost everyone. Advertising artist Vernon Grant, whose skinny-dipping soldier's bottom is a prime target for a mosquito bite, had already created Snap, Crackle, and Pop, the cartoon mascots for Kellogg's Rice Krispies, by the time he did this poster. And the mosquito lounging seductively on a soldier's bed pillow, and in the Give 'em Hell poster that we just looked at, first appeared in a 1943 anti-malaria booklet written by Theodore Geisel, known to all of us as Dr. Seuss. The Clinton Laboratories, located in Oak Ridge, Tennessee, and later renamed for the location, was the home of Manhattan Project research during World War II, and research related to energy and other scientific projects continues today. This set of health posters, made for Oak Ridge workers in the 1950s, uses bold visuals to get their points across. The little germ sticks his tongue out, but soap and water will soon take care of him. And how many times have we been told to cover our mouths and noses when we cough or sneeze? That little bird may be suffering from a cold, but he's doing a much better job of following hygienic practices than the fellow who just sneezes into the air, spreading his germs everywhere. And even though things look idyllic at this lakeside scene, The poster reminds people to keep them that way by getting a typhoid vaccine. Jumping forward to 1977, it's impossible not to smile at this U.S. Department of Health poster. C-3PO and R2-D2, who had just made their appearance in the first Star Wars movie, remind parents to make sure their children's immunizations are up to date. An enormous number of posters appeared in the wake of HIV/AIDS, beginning in the early 1980s. A Rubber is a Friend in Your Pocket is only one example of the many posters aimed at promoting safer sex. But other posters tried to reassure people at a time when the fear of AIDS often prompted irrational responses, that treating those with AIDS, especially children, with care and affection posed absolutely no risk. Some AIDS education campaigns reached out to different communities. This poster in Spanish acknowledges that talking openly about sex, homosexuality, and drug use could be very difficult in the Latino community, and offers support and the toll-free number for the AIDS hotline. And this one speaks directly to African American families, again offering help through the national hotline. The last item we'll look at today as part of this virtual visit was produced just last year. A comic book printed by the Charles B. Wang Community Health Center exists in both English and Chinese versions. Lynn, a newly hired nurse practitioner, spends her time helping local residents get tested for hepatitis B and demystifying it for them. She explains test results, encourages people who test negative to be immunized, and comforts a pregnant friend who never knew she was infected. Aside from the narrative, the comic book explains both how hepatitis B can be transmitted and how it can't in a very clear way. And in the end, all her hard work earns her praise from her boss and the promise of a new assignment. I hope you've enjoyed seeing some of these visually compelling items from the library's collection. Remember, you can always find us at nyam.org/library if you want to learn more or do research. And in the meantime, please stay safe, stay healthy, and wash your hands.